Ladies and gentlemen, welcome to the press conference of the European Center for Disease Prevention and Control. My name is Andrea Horvat-Kramaric. I'm head of communication and spokesperson, and I will be moderating this press conference. Today, we mark European Antibiotic Awareness Day by releasing the latest data on antimicrobial resistance and consumption, but also the EU status in meeting the 2020 AMR targets set through the Council recommendation on stepping up EU actions to combat antimicrobial resistance in One Health approach, endorsed this year. For this purpose, today we have with us ECDC Director Andrea Ammon. We have in Brussels from European Commission, Director General Health and Food Safety, Director for One Health, Domenech Amado. And we have here with us also Head of Antimicrobial Resistance and Healthcare-Associated Infections, Dominique Monnet. Before we open the press conference, just a few words on housekeeping. Please remain muted for the address of our speakers. And if you want to ask questions, please raise your hand, introduce yourself, and switch off your camera. The floor will be given to you, and you can also ask questions in the chat, and I will read it. This press conference is being recorded and will be released on our channels afterwards. I believe we are ready to start, so I will first give the floor to the ECDC Director, Andrea Ammon. Andrea, please, the floor is yours.
Thank you, and good morning also from my side, and welcome to this press conference. Antimicrobial resistance is a major health threat to people in Europe and globally. It is a threat to human and animal health as well as the environment because microorganisms move within each of these sectors and between the sectors. Therefore, the problem can only be addressed if these sectors work together. That is what we call the One Health approach. To address AMR challenges, the Council of the European Union adopted recommendations in June this year for stepping up the EU actions to combat antimicrobial resistance in a One Health approach. And these, the adoption of these recommendations show that there is a high level of consensus amongst the member states that AMR is a serious threat and that immediate action is necessary. The Council recommendations included 5 targets related to antimicrobial consumption and antimicrobial resistance to be reached by the EU by 2030, using 2019 as a baseline. These targets encompass a reduction in overall antibiotic consumption, specific antibiotic group preferences, and the mitigation of bloodstream infections caused by pathogens that are often resistant to several antibiotics at the same time. These recommended targets, the first EU targets for human health, represent an effective way to monitor progress and achieve goals related to prevention and reduction of antimicrobial resistance because they are concrete and measurable for the EU overall, but also for each EU member state according to their individual situation. ECDC has the mandate to monitor the progress towards achieving these goals. So the data that ECDC is publishing today, both on antimicrobial resistance and antimicrobial consumption, mark the first milestone in monitoring progress towards these targets at EU and member state level. Our overall conclusion is that although there has been slow progress in certain areas, recent data suggest that antimicrobial resistance remains a significant challenge in the EU EEA. And there is a need for intensified efforts to ensure that the targets are reached both at the EU and at each member state level. In particular, I like to highlight the situation with carbapenem-resistant Klebsiella pneumoniae infections in the EU that continues to deteriorate. The incidence of these bloodstream infections increased by almost 50% between 2019 and 2020. That goes, of course, against the goal of reducing these infections by 5% by 2030. And it is a concerning trend because for patients suffering from infections with carbapenem-resistant Klebsiella pneumoniae, there are very few effective treatments remaining. So Dominique Monnet will speak in more detail about the current progress that in reaching these various targets. But I want to emphasize that the progress at the EU level can only be as good as the progress of each individual member state. So some member states are more advanced in meeting their recommended targets, and some have already met them. Other member states must continue with their sustained efforts. Overall, as I said, more efforts are needed. So we urge, therefore, action too. Ensure that measures are to support prudent use of antimicrobials in healthcare settings are taken, long-term care facilities, and in the community. To strengthen infection prevention and control measures and policies in healthcare settings, long-term care facilities, and in the community. To promote the development and accessibility to novel antimicrobials and alternatives to antimicrobials. According to our estimates, each year in the EU, Norway, over 35,000 people die as a direct consequence of infections with bacteria that are resistant to antimicrobials. The number increased in recent years, and the impact of these infections on public health is comparable to that of influenza, HIV/AIDS, and tuberculosis combined. So what would happen if we don't do anything? Well, even simple infections could become difficult or impossible to treat with antibiotics or other antimicrobials, causing long-lasting sickness and sometimes death. In hospitals, intensive care, surgical procedures, organ transplants, and cancer treatments, they would be severely affected, as the success of these procedures and treatments rely on the availability of effective antimicrobials to prevent and treat infections. In addition, healthcare facilities could face an increase in patients with infections that are difficult to treat, putting further pressures on resources on an already strained situation. Finally, prolonged hospital stays, increased healthcare costs, and decreased productivity due to illness or premature death could lead to an increased economic impact on individuals, families, and societies. So ECDC will continue working together and provide data, evidence, and recommendations, including now an annual monitoring of progress towards the targets, so that member states and the European Commission can take necessary actions to address antimicrobial resistance at all levels. So, in conclusion, tomorrow, 18 November, we will be celebrating the 16th European Antibiotic Awareness Day. That is an European health initiative to raise awareness about prudent use of antibiotics and more general about AMR. A lot has been accomplished since the first edition of the European Antibiotic Awareness Day in 2008. For example, antimicrobial consumption in humans has gradually been decreasing, but the rebound in 2022 showed that it's not an autopilot to reduction, so more efforts are needed. For AMR, the increase in carbapenem-resistant Klebsiella pneumoniae bloodstream infections, as well as other resistant pathogens in many countries, is alarming. Obviously, for EU and for the EU and member states to reach the reduction targets, we will need to rapidly enhance our efforts towards a more prudent use of antibiotics and better infection prevention and control, particularly in hospitals and healthcare settings. We all are responsible. All actions from everybody at all levels, individual, professional, healthcare, national, regional, government, etc., count if we want to succeed. So it's up to us, every single one of us, to make sure that antimicrobials will remain effective to treat and prevent infections also in the future. Thank you.
Thank you, Director Ammon. So now we go to Brussels, to the European Commission, to the DG SANTE, Director One Health, Domenech Amado. Please take the floor.
Thank you. Thank you, Andrea. Thank you, Director Ammon. As Director Ammon has just already mentioned some key figures, we justify the action or the urgency to act against AMR. And he also mentioned the targets. I'm not going to repeat those. Maybe just to insist on the fact that AMR is not just a public health emergency, but also an economic imperative. Today's OECD report also shows that if every European country spent just 3.4 euros per capita every year on a mix of hospital and community-based antimicrobial resistance interventions, they could prevent more than 10,000 deaths, avoid over 600,000 new infections, and save more than 2.5 billion euro in their health systems. Otherwise said, every euro invested in prevention would bring nearly 3 euros in economic benefits. At OECD level, this ratio is 5:1, so something really to be considered. Today, 1 in 5 bacterial infections in Europe is caused by a pathogen that is resistant to antibiotics. In about 10 years, 9 out of 10 of hospital-acquired bacterial infections will be multi-resistant. In 2035, it might be more dangerous to go to a hospital than getting treatment at home if we don't tackle AMR as a matter of urgency. This is how Malta's Deputy Prime Minister Christopher Fern opened his speech at this week's meeting of TATFAR, the Transatlantic Task Force on AMR, with the US, the UK, Canada, and Norway. The meeting was back-to-back with a one-health conference where high-level participants, including Italian former Prime Minister Mario Monti, but also UK's Special Envoy for Antimicrobial Resistance, Professor Dame Sally Davies, unanimously pled for urgent action on AMR. The good news, if we can say that we have really good news, is that we don't need miracles for that. I will just mention 3 points. As Andrea Ammon was mentioning, tomorrow is European Antibiotics Awareness Day. And the first point would be really on awareness raising. But this day, like the International Week, is not enough to reach the public. I mean, still today, 40% of Europeans think that antibiotics kill viruses. 40%. Too many people still don't know that the abuse of antibiotics makes them ineffective. With the current awareness of AMR, we are where we were with climate change 20 years ago. We don't have 20 years to make people aware of the threat of AMR. We need to get clinicians, veterinarians, farmers to speak about AMR, because this is a problem not just for stewardship, but also for sanitation and vaccination of animals. We also need to keep telling our finance ministers that prevention is cheaper than cure. But we also need to have AMR champions who campaign for the fight against AMR, public figures, even celebrities. And in parallel, we also need to counter disinformation, because unfortunately, as with vaccines, the fight against AMR can also polarize views. My second point is on the need to propose effective measures at all levels of the biological chain: human, animal, and environmental. The Council recommendation Andrea Ammon was mentioning is also a proof of our One Health, multifaceted, cross-sector approach. The targets she mentioned are fundamental. In particular, the 20% reduction on antibiotic consumption by 2030, which follows another earlier commitment to reduce the sales of antimicrobials for farmed animals and aquaculture by 50%, also by 2030 in the context of the Farm to Fork strategy. These targets allow us to monitor, as the ECDC report shows, and compare progress among member states, and to adjust and intensify measures when necessary. What gets measured gets done. And the ESVAC report that you also got today, and that I understand will be published on Monday, shows, for example, that the sales of antimicrobials for farmed animals and aquaculture went down in the EU by over 28% only in 2022, which is very good news. However, targets alone are not enough. The recommendations covers a range of actions, including enhanced monitoring and surveillance, better prevention and control measures, boosting R&D, and incentives for innovation. And to complement this, our proposal to revise the EU pharmaceutical legislation puts forward specific solutions to stimulate the development of novel antibiotics, ensure access to existing ones, and improve the prudent use of all antimicrobials. On the veterinary side, in addition to the target I just mentioned, EU legislation also bans the use of antibiotics for prophylactic purposes and as growth promoters in certain farmed animals. We organize hands-on training sessions for farmers and veterinarians to raise awareness on the measures to fight AMR, and we provide direct grants to member states to help them improve their data collection and reporting on veterinary antimicrobials. On the environmental side, last year we proposed to strengthen environmental monitoring of AMR in ground and surface waters, while our pharma proposals will extend the environmental risk assessment of medicines to cover antibiotic manufacturing. Last but not least, our financial measures through the EU for Health program, 50 million euros investment to support a new joint action on AMR next year already, to help all member states to tackle AMR with a One Health approach, and 22 million to bring AMR countermeasures to the market and support member states in their procurement. Third, a word on global action. As Otto Kars, founder of REACT, well-known figure in the fight of AMR, mentioned at our conference, the One Health conference this week, we need global vision on AMR. And this is why we're trying to promote in all possible, we're trying to promote it in all possible international fora as devised in our global health strategy. We are leading discussions in the context of G7 and G20 to push for a global health agenda based on a One Health approach. And AMR is very high in this agenda. This is also our position in the ongoing negotiations on the pandemic agreement. And in parallel, we provide significant funding to low and middle income countries to support their AMR agendas. We also cooperate with them in the area of food safety and animal health, for example, supporting projects on antimicrobial stewardship in hospitals in sub-Saharan countries, African countries. We need to support surveillance programs and technology. 10% of the world's population still eats food that was produced with contaminated water. As I said, the EU, the US, UK, Canada, and Norway are very much aligned in the fight of AMR, but we need to go beyond. And next year, we will have a big challenge to make the UN high-level meeting on AMR an action-oriented meeting and not simply declaratory. We need global shared targets, maybe for research and development, ideally for antimicrobial consumption. We will see, but that's one objective. What I just said are sort of the basics for action. We also need to make the best use of artificial intelligence to monitor and manage AMR risks. We need to have better diagnostics. We need the industry on our side, and so on. And hopefully, we will manage to curb the tide of what Dame Sally Davis calls the grand pandemic of AMR. Thank you very much.
Thank you, Director Domenech Amado. Now we go to our Head of Antimicrobial Resistance and Healthcare Associated Infections, Dominique Monnet. Dominique, please, the floor is yours.
Good morning, and thank you for attending this ECDC press conference. Today, as every year for European Antibiotic Awareness Day, EC is publishing 2 reports with updates of its surveillance data for the year 2022. One report is on antimicrobial resistance. These are data from the European Antimicrobial Resistance Surveillance Network, EARSNet. And the other report is about antimicrobial consumption in humans, and these are data on the European Surveillance of Antimicrobial Consumption Network, ESACnet. These reports confirm once again the large differences in antimicrobial consumption and in antimicrobial resistance between EU/EEA countries. Both as well as corresponding electronic databases are accessible from the ECDC website and include detailed data. These are available for EU member states, EEA countries, European stakeholders to follow the trends and identify areas for improvement. One particularity this year is that for the first time, the reports include information on the progress towards the antimicrobial resistance and antimicrobial consumption targets for the EU, as well as for each individual member states that are presented in country profiles. To facilitate the use of the targets and understanding of the target, ECDC also publishes today infographics that summarize for the EU and for each member state individually the progress towards the recommended targets to be achieved by 2030. So let's first have a look at the targets on antimicrobial resistance. One first recommended target for the EU is a 5% reduction by 2030 compared to a baseline year of 2019, the last year before the COVID-19 pandemic. And a 5% reduction must be in the incidence of bloodstream infections, carbapenem-resistant Klebsiella pneumoniae. Klebsiella pneumoniae is a common cause of infections in healthcare. It's a frequent cause of hospital outbreaks if appropriate prevention and control measures are not taken. When a Klebsiella pneumoniae infection is resistant to multiple antibiotics, including to a last-line group of antibiotics such as the carbapenems, then there are very few effective treatments available for patients with these infections. Alarmingly, as mentioned by Director Andrea Ammon, the situation in the EU for this pathogen continues to deteriorate. The incidence of bloodstream infections with carbapenem-resistant Klebsiella pneumoniae increased by almost 50% between 2019, our baseline year, and 2022. This goes against the goal of reducing these infections by 5% by 2030. When looking at countries individually, the incidence varied widely between countries. 17 member states showed an increase that contributes to the increase at EU level rather than a decrease. The second antimicrobial resistance target is a 15 20% reduction by 2030, and for the EU overall, in the incidence of bloodstream infections with methicillin-resistant Staphylococcus aureus, also known under the acronym MRSA. Between 2019 and 2022, the incidence of MRSA bloodstream infections decreased by about 12%, which is close to the 15% reduction target. While individually 15 countries also showed a decrease, another 14 countries showed an increase, moving away from the national reduction targets. The third antimicrobial resistance target is a 10% reduction in the incidence of bloodstream infection with third-generation cephalosporin-resistant Escherichia coli. Between 2019 and 2022, this incidence decreased by almost 17%, indicating that the EU overall has already met the 10% reduction target that is supposed to be achieved by 2030. While individually 20 countries also showed a decrease, 9 countries still show an increase, moving away from the national reduction targets. Obviously, and as for the other antimicrobial resistance target, there is large variation between the countries regarding the antimicrobial resistance situation. The last two targets are about antimicrobial consumption in humans. The fourth target is a 20% reduction by 2030, and for the EU overall, of the total consumption of antibiotics in humans. This combines the community sector and the hospital sector. Between 2019 and 2022, the total consumption of antibiotics in humans decreased by only 2.5%, indicating only slow progress towards the EU target. After unprecedented reductions in 2020 and 2021, antibiotic consumption in humans rebounded in 2022. This might indicate that the patterns of winter respiratory viruses, social contacts, hygiene habits, and antibiotic-resistant practices may now be similar to what they were before the COVID-19 pandemic. To better understand these changes in antimicrobial consumption, ECDC conducted a specific analysis of the rebound in antibiotic consumption in 2022 compared to the changes in 2020 and 2021, with a focus on the community where most of the antibiotic prescription take place. This was published yesterday in Eurosurveillance. Finally, the fifth target is about ensuring that at least 65% of the total consumption of antibiotics in humans comes from the access group of antibiotics as defined in the AWARE classification of the World Health Organization. Antibiotics in the access group should be the first choice for common infections, as they contribute to the lesser extent to the emergence of antimicrobial resistance. For the EU overall, the percentage of antibiotics and of total consumption that were in the access group was only at about 60%. And only 9 EU member states had met or exceeded the target of 65%. All other member states were at various levels below the 65% target. So there's still progress to do. There are good news and information that is more worrisome, and ECDC will continue monitoring progress of the EU and other member states towards the 2030 targets in its annual reports each year. Thank you.
Thank you, Dominique. And now I open the floor for your questions. And while we wait for your questions, I have to say that we already have a question by Mose from Brussels Times, who unfortunately had issues joining, but I will read it out and we will, of course, reply to Mose. Are some infections generally antibiotic resistant for all patients, or does it also depend on their previous overconsumption of antibiotics? I believe, Dominique, you will be the right address for this question.
Yes, I can. First, at individual level, each time we are prescribed antibiotics, each time we take antibiotics, this will affect the bacteria in our body and the bacteria of our normal flora. They will become resistant. Many of them will become resistant, and they will stay resistant for a certain amount of time. There are studies with macrolides that show that this can last more than 6 months and sometimes up to a year. So this is a risk at individual level, and this says that each time we're facing a self-limiting infection, each time we have a viral infection, antibiotics are not active. There's no need to take antibiotics if they are not useful. Of course, if the situation deteriorates, then please consult a medical doctor to have an advice. If we take this now at population level, there are areas, especially in hospitals, where the care of patients depends on receiving antibiotics and having access to effective antibiotics. I'm thinking in particular of intensive care units, oncohematology units, and patients with leukemia, all the patients that receive treatment, chemotherapy for treatment of a cancer. These patients will receive more often antibiotics, and they will be more resistant in those areas where these patients are treated. So at population level, the higher the frequency or the percentage of patients that receive antibiotics, the higher the risk of seeing infections that are resistant to antimicrobials.
Thank you, Dominique. So now we have a question from you, Rinke van der Brink. So please, Rinke, go ahead.
Yes, Rinke van der Brink in Amsterdam, or actually in France, but I'm from Amsterdam. I have a question, I think for Dominique too. Since one of the main goals of 2030 is reducing the number of bloodstream infections by resistant Klebsiella pneumoniae, I wonder whether there are any data on colistin resistance, colistin being one of the few remaining options in case of a CPE bloodstream infection.
In the past, we had included data on colistin resistance as part of our surveillance report on antimicrobial resistance. We stopped doing this. One issue that we have is the quality of the reporting of colistin resistance by the clinical microbiology laboratories and ultimately to our surveillance database. This is an issue that is known. This is an issue which has been acknowledged by the European Committee on Antimicrobial Surveillance, Antimicrobial Susceptibility Testing, UCAS, sorry. And for the time being, we do not have a solution. So I would phrase this as difficulties with antimicrobial susceptibility testing for colistin at the local level in clinical microbiology lab, and therefore unreliable data that would be available at national level and at EU level, unfortunately.
Thank you, Dominique. And now we go to Plos from Digital Health. Plos, please take the floor.
Yeah, thank you very much. This is Ziad El-Khatib. My question is, I think it goes to Dominique, Dominique, you mentioned regarding the utility of artificial intelligence. Are there any guidelines in place that if any EU or EA member states would like to use it so that they can know what practices can be put? Thank you.
Thank you, Plos. I believe you mentioned the director, Domenech Amado, so please, Rosaire, first to you.
Thank you. No, we don't have specific European guidelines, but definitely this is an area where we will be working how best to use, and we don't have a lot of time to waste. But yeah, and we can keep you posted on whatever we do in this area. This is clearly unanimously an area that all those that are involved in the fight of antimicrobial resistance see as the game changer, obviously.
Thank you. Do we have to hear something to complement on our side on this? Okay. No. So any other question, please, from the audience? I still have some questions already asked, so I can ask those. So has ECDC identified risk groups where prescription of antibiotics is too high? Maybe Dominique.
Well, I would say that in all groups of patients in the community, children, all of us, in hospitals, in particular for prophylaxis of surgical infections that are more than often too long, last more than one day, and will by May next year, we'll have an update from our point prevalence survey of healthcare-associated infections and antimicrobial use in acute care hospitals, and there will be an update on this. But the past surveys have shown that about 60% of the prophylaxis for prevention of surgical infections are last more than one day, so are much too long than what they should be as per the guidelines. So this is an area where there's overprescription and there could be savings. And then we know that in those areas that I mentioned before, in particular intensive care units, there are also efforts to streamline antibiotic prescription. As part of a point prevalence survey, we found out that the higher the percentage of antibiotic prescriptions in acute care hospitals in the EU that are checked, reviewed, and changed, the lower the resistance in those acute care hospitals. So review and check and change can be just stop. I mentioned stopping an antibiotic prescription for surgical prophylaxis that is lasting for too long. That can be just stop treatment because there's no need for treatment anymore. That could be de-escalate the spectrum of a treatment that is being given, moving from multiple broad spectrum antibiotics to less or narrow spectrum antibiotics. Or that could be going for more broad spectrum antibiotics because suddenly the results came from the laboratory and the treatment that was given was no effective. But whatever change, just having an infectious disease specialist or a clinical microbiologist come to the patient, check which treatment is given, and take action, results or was associated in the member states that participated in the survey in 2016-17 with reduced antimicrobial resistance.
Thank you, Dominique. Do we have any further questions? Okay, we go back to Rinke again. So Rinke, please go ahead.
Dominique, what you just said, that comes to antibiotic stewardship.
Yes, it's a way to summarize, but I didn't want to use the term. The term is
Okay.
Yeah, it's a general term that encompasses a lot of activities. We just identify as part of a point prevalence survey that this specific action, which is an action that everybody can identify, checking, reviewing, and if necessary, changing prescription, is a very concrete action that hospitals and wards and units can do in Europe.
Thank you, Dominique. Rinke, I hope that answers your question. Do we have more questions from the audience? If we don't, then I will have to close the press conference. I would like to thank our speakers. Thank to Director José Domenech Amado for joining. Thank to our speakers here, Andrea Ammon and Dominique Monnet. If you have any questions, please don't hesitate to ask us in our press mailbox. And until further opportunity, we say goodbye from Stockholm.